All right, so we've done hip anatomy, hip assessment, now rehab exercises. How are you going to get them better to get them ready to participate? So first thing you're going to work on is hip stretching. So there's a million different hip stretches out there. These are just some that we use. You want to make sure that everything is in alignment when you're doing this. You don't want them in an awkward position or increasing their pain. Feeling it's okay, pain is not. So a simple lunge stretch or using a foam roll or a piriformis stretch, the figure 4 or the Hollywood spine crossovers, butterflies or frog or pigeon. Really, any of these are hip stretching. Then you want to work on strengthening. Hip strengthening, the easiest, best, most commonly used is what's called Jane Fonda's or 4-way hips. It's when you take a band in that upper right-hand corner there, and you are literally putting a band or a weight around your ankle, and you move your leg in all 4 directions. So hip flexion, hip extension, hip adduction, and hip abduction. Now, adding the weight, laying down, all increases the difficulty. There's also machines that you've probably seen in gyms that you could do the exact same thing where you're standing and it's like a swing and you can rotate where the weight is and how much weight. You can also do this standing with a picture in the middle with a band attached to a wall. Same movements, same thing. You're working on stability. The next most important thing is clamps and reverse clamps. So those are the pictures of the guy in the blue shorts. So you put a band around your knees, and a clamp is the one that's on the right-hand side. So you keep your feet together and separate your knees. And you have to make sure that they don't rotating their hip back in the process. Their hips stay stable, only the knee moves, literally like a clamp. Reverse clamps, the band is then rotated down to their ankles, and they keep their knees together, and they separate their feet. It's a little bit more awkward feeling, so people have more difficulty with it. Planks or side planks are also another good hip strengthening tool. Then you're going to look at flexion exercises, okay? So we want seated knee leg lifts like that guy in the chair, or you can even do it on the edge of a table so you get more range of motion. Bridges, step-ups, like onto a cooler, onto a bench, leg swings, skater squats, which is what that woman's doing. Basically, you squat and then you push out, and lunges. Those are all the types of hip flexion exercises, or even squats just in general that we're using, body weight squats, wall sits, anything like that. Hip adductor exercises. So you want to add the adduction component, so pushing in. That's when you lean against a wall in a wall sit, and you put a ball between their knees, so they're in a squatting position, and they have to keep the ball together. Also, you have side lunges or lateral band walks, and skaters, meaning pushing off on a slide board, just like you're like ice skating or rollerblading or anything like that. Hip extension exercises. There's the backward 45, so you put a band around their ankles, you're in a squat position, you back one leg up 45 degrees, then you bring the next leg towards it and backwards. These exercises seem kind of lame, but with the resistance and the focus on the smaller muscles in the glute area, it makes it incredibly difficult. Glute squeezes, literally just laying on the table and squeezing your glutes. Some people don't even know how to do that. So make your butt tight and then relax. Press-ups, like that diagram on a figure 4, pushing your foot straight up into the sky. Or then you have Swiss ball roll-ups, go in a bridge position and roll that Swiss ball in towards you. There's many other exercises that you can do, but this is kind of a general concept for hip strengthening.